The purpose of this video is to give a brief overview on how to use the data dashboards from the Behavioral Health Initiative of West Virginia. In order to access the data dashboards, you go to behavioralhealthworkforcewv.com and click on this link here to the right that says data. These dashboards are publicly available information that are used for people who would like to know more about the supply, pipeline, and demand of the behavioral health workforce. I'm first going to look at the supply dashboard. This dashboard gives an overview of the workforce. This first page is the total workforce per county of the 6 core behavioral health professions. We define the behavioral health professions as master's level and above individually licensed clinicians. If you hover over the county, you get a breakdown of each workforce. And if you click on one of these green buttons, it will bring you to another map where if you hover over the county, it breaks down each workforce further. I recommend you pressing the back button embedded in the dashboard, not your browser back button. The next sheet is the same information presented in a different way. And then we have a visual of the disparity of the total workforce by the top 10 counties in West Virginia and the bottom 10 counties in West Virginia. Light blue are the top counties, dark blue are the bottom counties. Next, we have the workforce that's adjusted for population. It's per 10,000 people. And finally, we have the same workforce disparity visual, but adjusted for population. Clicking on the back button, your browser's back button will bring you back to here. And we'll look at the pipeline dashboard. This dashboard shows you education and licensure trends of the behavioral health workforce. The first is the general trend of the workforce, which is from 2017 until 2020, which is growing. Next, we look at some graduation versus newly licensure trends. These next pages show the numbers of graduates from West Virginia institution versus the number of newly licensed clinicians in that profession. Counseling requires at least 3,000 hours of supervised counseling experience, with up to 600 of them prior to graduation, before you can be individually licensed. West Virginia is unique with psychology in that we license both master's and doctorate level psychologists. Master's level requires 5 years of supervised practice before licensure. Doctorates require 1 to 2 years, depending on their internship that was prior to graduation. Social workers do not need postgraduate experience before they can be licensed at the basic master's level licensure. West Virginia does license bachelor's level social workers, but as I had said, we are looking at master's level and above for the core behavioral health workforce. Finally, on this dashboard, you will find some wage data. If you click here on the right, you can change professions. It shows you entry level, experience level, mean and median wages here in West Virginia for each of these professions. The last dashboard that we will be looking at is the demand dashboard. Now, demand data is not as straightforward as supply data. Therefore, I have put various demand indicators for you to use, all at the county level. The first is from the Behavioral Risk Factor Surveillance System, which has 2 different indicators, percentage of distress per county and unhappy days per month. unhappy days a month per county, average number. I've added these together to come up with mental stress per county. This is the rank of the counties per mental stress. And here's the visual. Next few sheets look at deaths by suicide and deaths by overdose. The first are the total deaths. And next we look at the deaths adjusted for population. A note about these deaths. Firstly, these are from the decade of 2010 to 2019. Additionally, data has been suppressed if any of the deaths were reported between 0 to 4 in that time period. It was suppressed to 0 deaths for privacy reasons. Finally, we are looking at the opioid use disorder prevalency as a demand indicator. This is percentage of the population of the county. And this sheet looks at the percentage of the population that has opioid use disorder per county that has access to medications for addiction treatment. Bringing it all together in this last sheet are the counties with greatest need. These counties were found by ranking the mental stress per county that we found here at the beginning of the dash, here with the behavioral risk factors surveillance system, and also ranking the counties per behavioral health workforce adjusted for population. Once we had those two rankings, I added them together to come up with the overall rankings by need. You can see if you hover over each county what their rankings were, and the overall ranking and list of these counties are here. I hope these data dashboards are useful to you. We will be updating these dashboards annually and whenever we get more data in order to keep these as up to date as possible. Thank you very much.